The Inspector General of the Environmental Protection Agency, August 21, 2003, report numbered 2003-P-00012 and entitled EPA's Response to the World Trade Center Collapse, Challenges, Successes, and Areas for Improvement, includes the following findings. Quote, when the EPA made a September 18th announcement that the air was safe to breathe, it did not have sufficient data and analyses to make such a blanket statement. At that time, air monitoring data was lacking for several pollutants of concern, including particulate matter and polychlorinated biphenyls. Furthermore, the White House Council on Environmental Quality influenced through the collaboration process the information that the EPA communicated to the public through its early press releases when it convinced EPA to add reassuring statements and to delete cautionary ones. Quote, as a result of the White House's Council on Environmental Quality's influence, guidance for cleaning indoor spaces and information about the potential adverse health effects from World Trade Center debris was not included in EPA-issued press releases. In addition, based on the Council on Environmental Quality's influence, reassuring information was added to at least one press release, and cautionary information was deleted from the EPA's draft version of that press release. The White House's role in the EPA's public communications about the World Trade Center environmental conditions was described in a September 12, 2001 email from the EPA Deputy Administrator's Chief of Staff to senior EPA officials. Quote, all statements to the media should be cleared through the National Security Council before they are released. According to the EPA Chief of Staff, one particular Council on Environmental Quality official was designated to work with the EPA to ensure that clearance was obtained through the National Security Council. The Associate Administrator for the EPA Office of Communications, Education, and Media Relations said that no press release would be issued for a 3 to 4 week period after September 11th without approval from the Council on Environmental Quality contact. Acting EPA Administrator Marianne Horinko, who sat in on the EPA meetings with the White House, has said in an interview that the White House played a coordinating role. The National Security Council played the key role, filtering incoming data on ground zero air and water. Horinko said, quote, I think that the thinking was these are experts in weapons of mass destruction, so they should have the coordinating role, unquote. In the cleanup of the Pentagon following September 11, 2001, Occupational Safety and Health Administration laws were enforced and no workers became ill. At the World Trade Center site, the same laws were not enforced. In the years since the release of the EPA Inspector General's above-cited report, the Bush administration has still not effected a cleanup of the indoor air in apartments and workspaces near the site. Screenings conducted at the Mount Sinai Medical Center and released in the September 10, 2004 Morbidity and Mortality Weekly Report of the Federal Centers for Disease Control and Prevention produced the following results. Quote, both upper and lower respiratory problems and mental health difficulties are widespread among rescue and recovery workers who dug through the ruins of the World Trade Center in the days following its destruction in the attack of September 11, 2001. Continuing to quote, an analysis of the screenings of 1,138 workers and volunteers who responded to the World Trade Center disaster found that nearly 3/4 of them experienced new or worsened air respiratory problems or upper respiratory problems at some point while working at ground zero. And half of those examined had upper or lower respiratory symptoms that persisted up to the time of their examinations, an average of 8 months after their World Trade Center efforts ended. A larger study released in 2006 found that roughly 70% of nearly 10,000 workers tested at Mount Sinai from 2002 to 2004 reported they had new or substantially worsened respiratory problems while or after working at ground zero. This study showed that many of the respiratory ailments, including sinusitis and asthma, gastrointestinal problems related to them, initially reported by ground zero workers, persisted or grew over time. Most of the ground zero workers in the study who reported trouble breathing while working there were still having those problems 2.5 years later, an indication of chronic illness unlikely to improve over time. In all these actions and decisions, President George W. Bush has acted in a manner contrary to his trust as president and subversive of constitutional government, to the prejudice of the cause of law and justice, and to the manifest injury of the people of the United States. Wherefore, President George W. Bush, by such conduct, is guilty of an impeachable offense warranting removal from office. I yield back.
The gentleman yields back. Under Rule 9, a resolution offered from the floor by a member other than the majority leader or the minority leader as a question of the privileges of the House has immediate precedence only at a time designated by the chair within 2 legislative days after the resolution is properly noticed. Pending that designation, the form of the resolution noticed by the gentleman from Ohio will appear in the record at this point. The chair will not at this point determine whether the resolution constitutes a question of privilege. That determination will be made at the time designated for the consideration of the resolution. The chair lays before the House the following personal requests.
Leaves of absence requested for Ms. Harmon of California for today, Mr. Lucas of Oklahoma for today, Mr. McDermott of Washington for today, Mr. Meek of Florida for today, Mr. Ortiz of Texas for today and the balance of the week, and Mr. Pierce of New Mexico for today.
Without objection, the requests are granted. Under the Speaker's announced policy of January 18, 2007, and under a previous order of the House, the following members are recognized for 5 minutes each. Mr. Poe of Texas, Mr. Jones of North Carolina, Ms. Ferranz of Kansas City, Mr. Brown of Georgia.